Alright, so now the joints chapter. Now it is joints, the other name for joints just means articulations, so just basically connections between the bones. We're going to see that there are joints based on what they're made up of. We're going to see that some joints are made up of fibers, some joints are made of cartilage, and other ones that we're more familiar with are synovial joints. Okay, and also we need to know here, I'm going to put a star, know these words, synoarthrotic joints, you cannot move them at all. We're going to go through what those are. Amphiarthrotic, you can move them a little bit. Diarthrotic are the freely movable ones. Okay, so we're going over the types of joints here. Fibrous joints. So fibrous joints, they're named this way because they have a lot of fibers. So they are made up of dense connective tissue. There are three types of fibrous joints. Okay, so know that these are the three types: syndesmosis, sutures, and gomphoses. So for these different joints, I want you to know examples for these. Know that the syndesmosis type of joint is between the tibia and the fibula. And so you're seeing here the connections. It's also between the radius and ulna, but you can just know it as the tibia and the fibula. So those connections are the syndesmosis. Sutures, well, we already learned about sutures. Know that these are in your skull. They're connecting your skull bones to each other. Gomphoses, know that these are for the tooth attachments. That is no teeth. Okay, so these ones that we went over, you cannot move these at all. Next, cartilaginous joints. Cartilaginous joints, they're made up of obviously cartilage. It can be hyaline or fiber cartilage. And know that these are the two types of cartilaginous joints. Synchondroses, these are the rib cartilages and the epiphyseal plate. And so here, they're just made up of hyaline cartilage. Next is symphysis. Now, also made up of cartilage, it's just that they also have fiber cartilage. So that's what is different from the synchondroses. Okay, a little bit of movement here. So then know that symphyses, pubic symphysis, and intervertebral discs are both types of symphysis joints. Okay, so now the joints that we are familiar with that you can move, synovial joints. So a few characteristics of synovial joints we already know here. Articular cartilage lines the ends of the bones. Joint capsule means that in the joint, this is the covering of the joint. So the outer part. Okay, the next one, synovial membrane. We're seeing here the synovial membrane labeled. This is the membrane kind of holding the joint in place. You see it on this part too. Okay, synovial cavity and the synovial fluid. This space in between the two bones, you can either call it the joint cavity or the synovial cavity. And know that this space in this cavity, there's fluid, and it's called the synovial fluid. And the synovial fluid is for lubricating joint, make sure that it is moving smoothly. Alright, so then also synovial joints can have these other structures. What it's saying here, bursa and tendon sheaths. So bursa, think of them as little cushions. These can be between the bones and ligaments or bones and tendons. And so these are to protect against friction in these parts. And so here we're seeing this part, so that's a bursa. So think it kind of looks like a little pillow. Then the tendon sheaths are protecting the entire tendons. So know that these wrap around the tendons where these are by the joints to protect them from friction. And so bursitis is the inflammation of the bursa and tendon. Okay, so now the different types of synovial joints, quite a few. And again, we just have to know the examples for these. Ball and socket joints, these have the most range of motion. And hip and shoulder are the examples for these. Condylar joints, they named it because of the shape. So these ones are found between our metacarpals and phalanges, meaning where your fingers attach to your palm. And so if you do the movement, you can see that your fingers can go side to side, you can bend them, and you can do kind of like a circular motion. Plane joints, also called the gliding joints, these are found in the wrist and ankle joints. So when you do this waving motion in your hand, this is actually when your wrist and ankle bones are sliding past one another. Then the hinge joints. Hinge joints, just think kind of like the hinges on the door. You can only open and close the door. So in hinge joints, you can only do bending and straightening motions. So know for these that your elbow, your knee, and also between your phalanges are the hinge joints. Pivot joints. Pivot joints are for rotation. And here the good examples of this between the atlas and the axis. And so this allows us to rotate our neck. Saddle joints. Saddle joint is for your thumb only. So it's between the carpal and the metacarpal of the thumb only. And so more specifically, you're seeing it here. It's between the connection of the trapezium and the first metacarpal. Okay, so next, when we get to the muscular system, we're going to see that muscles are attaching to our bones. And so when the muscles contract, they pull on the bones that they attach to. So muscles attach to two different bones, we're going to see. And the beginning part of the muscle where it attaches to a bone is called the origin. And the bottom part of the muscle is called the insertion. So I'm going to go over these with you guys as we go through, especially the muscular chapter. Okay, so now the types of movements, and that worksheet that I put together for you, that will definitely help you. But so I'll just kind of explain some of these. Abduction versus adduction. Abduction is when you move your arm or your leg to the side, and adduction is when you move them back in. Flexion means bending at the joint, and extension means straightening. Hyperextension means bending it even more to the back. Lateral flexion, here you're seeing it in the second picture. This is when you bend side to side. And this is really just done with your back. Dorsiflexion versus plantar flexion. You're seeing it here in the first picture. Oops. Dorsiflexion means when your toes point up. Plantar flexion, when your toes point downward. Circumduction, making a circular motion. So you can either do this by rotating your arm at your shoulder or your thigh. Rotation of the neck, which they didn't show there, but you know how that works. Medial rotation versus lateral rotation. You're seeing it here. You can do this with your arm or your leg. Medial rotation means when you move your arm towards the front. Lateral rotation, when you move it to the side and to the back. And then supination versus pronation. Supination, when your palm faces up. You can see here in the picture. Pronation, when your palm faces downward. And so this is done by the rotation between the radius and the ulna. A few more here. Inversion versus eversion. These are for the feet. Inversion, when the bottom of your foot faces towards the medial side. Eversion, when you turn it, and here the bottom of your foot faces out instead. Protraction, when you move your jaw, or it could be your shoulder, towards the front. And retraction, when you move it to the back. Elevation versus depression. Elevation, move up, depression down. And so you can see here shrugging of the shoulders involves elevation and depression. Okay, so then we're going to go over the major synovial joints, not all of them, and we're going to see here what ligaments make up these different joints. So know that in the shoulder joint, there's the coracohumeral, glenohumeral, and the transverse humeral. And as you can see from the names, they refer to the parts of the bones that make up the shoulder joint. Okay, so just be able to recognize these names and pick them up in let's say a multiple choice question. Next, the elbow joint. Know that these are the main ligaments. There's the radial collateral, ulnar collateral, and the annular ligament. Again, for these joints, just be able to recognize the names. You don't have to identify these on a lab exam. It's not going to be on the lecture exam, but just again know it on a multiple choice question. Which ones are belonging to which joint. Hip joints, here we have the iliofemoral, pubofemoral, and the ischiofemoral. I'm going to add one more here. That's called the ligamentum teres. This is supposed to be an M. Ligamentum teres is located between the head of the femur and the acetabulum. Then the knee joint. Knee joint will definitely be on your lab exam. So either the model of the knee joint, or I could use the picture. And so on the knee joint, now these could be on the lecture exam, know that these are part of the knee joint, but then also, of course, for the lab exam, be able to identify them. Patellar ligaments. Patellar ligaments is this here. So this is the bottom attachment of the patella. If you just imagine the patella being over here, this ligament holds the patella in place. Tibial, or you can say medial, and the fibular or the lateral collateral ligaments. These are on the sides of the knee joint, labeled over here. Anterior posterior cruciate ligaments are on the inside. So these are called the intracapsular ligaments. The anterior cruciate ligament is more in the front. Posterior cruciate ligament is a little bit thicker, and that's on the more on the back side. Then the medial and the lateral meniscus. The plural of meniscus is menisci. And these are the cartilages in between the femur and the tibia. And so the tibia is on the medial side, fibula is on the lateral side. And so the side on the fibula is called the lateral meniscus, right over here. And if it's more on the side of the tibia, then it's the medial meniscus. Different joint disorders or pains, injuries, sprains. Know that sprain means tearing of the ligaments. Bursitis, inflammation of the bursa. Then the different types of arthritis here. Rheumatoid arthritis. This is actually an autoimmune disorder. So here, we don't quite understand why, but here the white blood cells are attacking the joints. Osteoarthritis. This is degenerative. Now this occurs with aging and also just overuse of the joints. So over time, your joints get deteriorated. Then Lyme arthritis. Know that this is caused by Lyme disease, which is actually bacteria. And this bacteria is passed through tick bites. So know that these different types of arthritis, all of them involve the degeneration of the joints, and especially the cartilages, the cartilage that is located in these joints. So I'll add that over here too. Then our book goes into, again, what happens as we get older. Joint stiffness, arthritis as we get older, especially osteoarthritis. Fibrous joints, saying first start to change, cartilage changes. But yeah, so all things that kind of depressing things happening as we get older.